name is Denise Butler, and today I'm going to start my head-to-toe assessment. This is my patient, Aaron. And prior to coming into the room, we had him empty his bladder. He did the Snellen and Rosenbaum eye charts for visual acuity. We got his height and weight, and his vital signs were all within normal limits. So looking at Aaron, initially I'm looking at his skin color and head and face for any abnormalities. Looking at the symmetry of his eyes, his ears, and his nose, looking at his head and scalp and his hair texture. So I'm going to start by palpating his head, feeling for deformities, and everything feels fine. And then onto his face, feeling his facial bones. At the TMJ, I'm going to have him open his mouth and close, and I don't hear or feel a click. I'm going to feel for his sinuses, for any tenderness. Do you have any tenderness?
No.
All right. So the skin looks and feels okay. I'm looking at his eyes, looking at his eyebrows, his eyelashes, his eyelids. There's no drainage or obvious deformities there. His sclera and conjunctiva look white. I'm going to palpate the lacrimal apparatus. I'm going to use my light here, and I'm checking for pupillary response, both direct and consensual in both eyes. Okay. Then I'm going to have you use this pad of paper, and looking at a point on the wall in the distance, I want you to cover one eye. Okay, keep looking at that spot on the wall and uncover. Okay, and then cover the other eye. Continue to look at that spot on the wall and uncover. Okay, good. All right, if you'll look at my finger and just follow it with your eyes. Okay, and if I had my ophthalmoscope now, I would do the red reflex and fundoscopic exam. So next, I'll start on his left ear. I'm just looking at the color of the ear for bruising, any deformities, drainage. I'm going to palpate for tenderness, and then we'll do a whisper test. So if you'll plug your left ear, I'm going to say a word.
Baseball. Football.
Okay, good. And then I will use my otoscope to pull the ear up and back and examine the tympanic membrane. It should be a pearly gray. You should see a cone of light in the bones of the ear, and no bulging or redness. I would do the same on the right ear. Again, I'm looking at the color for bruising or deformities. I'm palpating for tenderness. There's no drainage from the ear. And again, with my otoscope, I'd pull the ear up and back and examine the tympanic membrane, finding any abnormalities. It should be a pearly gray cone of light and see the bones of the ear. I'm going to test his light touch sensation. So I'm going to have you close your eyes and you say yes when you feel me touch your face.
Yes. Yes. Yes.
Okay, good. And then to test hearing, we're going to do the Weber test with the tuning fork. And so I want you to tell me if you can hear it better in your left ear, your right ear, or both equally.
Both.
Okay, good. And then with this exam, it also tests your hearing through conduction and air. So I want you to tell me when you can no longer hear it.
Stop. Stop.
And we'll do the same on the right.
Stop. Stop.
Okay. That concludes the ear exam. So now I'm looking at his nose. It's centered in the middle of his face. There's no drainage. He doesn't appear to be stuffy. The septum is midline. So with my pen light again, or my light, I'm going to look into the nose, looking for any drainage. I'm noting the mucosa is a light pink, and looking at the turbinates. There's no lesions in there that I can see. Good. And then we'll test the patency. So if you'll plug one there, and then breathe in and out, and the other one. Okay, moving on to the lips. I'm looking at the color of his lips, and there's no lesions around his mouth. I will have him open his mouth. Oh, you can put your tongue in. Just open. And again, I probably use my light to get a better view. His tongue is symmetrical. It's pink. It's moist. It's not dry or cracked. The mucosa is pink. The hard palate and soft palate are intact, and they're pink and moist. I'm looking at his teeth, noticing the surface and the characteristics. If you'll lift your tongue up, the frenulum is intact. Again, there's no whiteness or white patches or any lesions. And then stick your tongue out. Good. The uvula is midline. The oropharynx is pink. There's no redness. I can see the tonsils, but they're not touching or red. All right, you can close your mouth. Thank you. And that concludes the head, eyes, ears, nose, and throat portion of the head to toe exam.